my name is Ritu Barwa and I'll present an analysis of the 2009 H1N1 pandemic. Step 1 Background of H1N1 virus. The pandemic occurred at the backdrop of swine infection that were traced to contact with pigs. It was the first influenza pandemic of its magnitude since the influenza pandemic of 1968 through 1969. First two cases were reported in California among children, and the virus-contained gene segment were not previously reported in animals or humans. By April, the pandemic had spread globally with infections in over 212 countries. In June 2009, H1N1 was declared a global pandemic by the World Health Organization. This is a statistic of H1N1 in the US. The pandemic peaked during the summer and fall of 2009 and remained low during the winter months. The first wave was characterized by geographic widespread of the infection across the US and other countries. The second wave, which peaked in November 2009, interrupted the school calendar. It was speculated that the second wave was triggered by the reopening of school in mid-August and early September. Step 2 Situational Analysis. H1N1 was the first spreading influenza virus that had not been previously reported. CDC was responsible for responding to the H1N1 influenza pandemic. Its actions were in line with its mission to work 24/7 to protect America from health, safety, and security threats, both foreign and in the US. Whether disease starts at home or abroad, are chronic or acute, curable or preventable, human error or deliberate attack, CDC fights the disease and support communities and citizens to do the same. The goal for CDC was to reduce transmission and severity of illness and to provide information to help healthcare providers, public health officials, and the public address the challenge posed by the new virus. The agency collaborated closely with animal and human health officials and the international health community. Step 2 Situational Analysis SWOT Analysis. First, strands H1N1 occurred at the backdrop of pandemic preparedness, including good response planning, availability of surveillance mechanism, and a strategic national stockpile that include antiviral drugs and personal protective equipment. Weaknesses. Despite prior preparedness, there were delays in the development and the distribution of the vaccine across the country and globally. Vaccines were unavailable the most countries in good time, leading to the widespread infection opportunities. Lessons learned during the pandemic were used to improve global preparedness for future pandemic. In response to the pandemic, most countries across the globe increased their pandemic stockpile. Threats. Since the 1918 influenza pandemic, influenza pandemics keeps on recurring. Therefore, it's a threat that the pandemic may reoccur in the future. Step 3 Causal transmission signs and symptoms of H1N1. 2009 H1N1 pandemic contained a combination of genes that had been previously reported in animals and humans, including swine, avian, and human influenza infection. Children and adults with other infections such as cardiovascular disease were at the most at risk. Human-to-human transmission was through aerosol droplets or touching of infected surfaces. The range of symptoms varied across patients with fever, cough, sore throats, rhinorrhea, diarrhea, and vomiting being the most prevalent symptoms, and the symptoms were consistent with those of previous influenza infection. Step 4 Cases, Solution, Response Activities. The first two cases were tested by the CDC to confirm the H1N1 virus. This was followed by the surveillance, monitoring, and testing for the other cases across the country and in the neighboring countries, including Mexico and Canada. Contact tracing and tracking of the virus was initiated. The CDC collaborated with pharmaceuticals to develop a vaccine virus and expedite vaccine production. In June and July 2009, vaccines were distributed and vaccination efforts ramped across countries. The CDC provided guidance on public health prevention measures, including vaccination campaigns and social distancing measures to be implemented across the country. The CDC also spearheaded public health communication to enhance credibility and prevent public panic. Step 4 H1N1 Management, Prevention, and Challenges. Antiviral medication including Zamavir for patients with complicated illnesses and oseltamivir for children less than 1 year old. To prevent transmission of the H1N1 virus, public health advisories on hygiene and isolation of infected persons were issued. Vaccination effort targeted 159 million vulnerable persons. At-risk persons who were targeted for vaccination include pregnant women, healthcare workers, people who lived with infant under 6 months, children aged 6 months to 24 years, and adult aged 24 to 65 years with compromised immune system. Challenges faced during management and control of the H1N1 virus include public misinformation and panic, lack of adequate surveillance mechanisms, and delay in vaccine production and distributions. Step 4, theoretical perspective. In my view, the response and the management of the pandemic can be explained using the system theory. The theory explains complex phenomena such as pandemics by examining relationships and interconnectedness. System elements applied include 1. Interconnectedness. To effectively manage the pandemic, there was need for examining the various factors influencing transmission, including epidemiology, culture, and preparedness. Feedback. Number 2, feedback. CDC collaborated with various stakeholders to ensure clear communication and feedback mechanisms. Number 3, adaptability. Proper management of the pandemic required public health system to quickly adapt to the changing situation, including increased numbers of hospitalization and new variant and strain of the virus. Successful management depended on the resilience of public health system. Number 4, holistic approach. To effectively manage the pandemic, CDC and global health system adopted a holistic, multi-phased approach that include testing, surveillance, health communication, and research. Management also considered the economic, cultural, social, and political factor influencing transmission and response. Step 5, recommendations. According to the report by CDC, recommendation for management of influenza outbreak include number 1, the use of influenza risk assessment tool and surveillance mechanism to enhance control and management of influenza outbreaks. Number 2, enhancing and streamlining communication during the pandemic. Number 3, enhancing collaboration and strengthening influenza research and vaccine development across the globe. Availability of vaccine technology ensures immediate vaccine development and protection of at-risk population during future outbreaks. Number 4, improving public health infrastructures to enhance treatment and management of the outbreak. Step 6, action plan. Since the 1918 H1N1 influenza pandemic, there have been several more influenza pandemics. The control and management of the viruses are comparable despite the differences in their genes and biomarker. Global action that can be taken to improve influenza prevention, management, and control include the first one being strengthening global surveillance and monitoring mechanism. Parties responsible for ensuring this include CDC, World Health Organization, national public health agencies. Step includes assessment of the available surveillance mechanism and planning for improvements and expansions. Development of strategic public health goals, definition of protocol to be followed in case of an outbreak. The second one is strengthening influenza research and vaccine development. Responsible parties include World Health Organization, CDC, academic and scientific communities, and pharmaceuticals. Steps to achieve this include assessment of the current state of influenza research, identifying priority research areas such as vaccine technology, planning for funding and research allocation, research testing, and evaluation of vaccine samples. The projected timeline for each of these action plan is 1 year. Step 7, opinion. In my view, the response by the CDC to the pandemic was prompt and thorough. The CDC conducted testing on all suspected cases across the country and all neighboring countries. CDC collaborated with major stakeholders including the World Health Organization, pharmaceutical companies, and human and animal public health officials. 24-hour updates by the CDC helped and provided a clear and credible information, thus influencing public response. And these are my references.